Hello, everyone. My name is Amanda, and I am from NYU Ambulatory Care Center, which is on 38th Street, where we have our physical therapy, occupational therapy, speech therapy, and some other doctor's offices there. And I'm here to talk to you today about managing lymphedema through rehabilitation. Has anyone here been to physical therapy over at 38th Street? Okay, so some of you have been. So hopefully it's going to be a review and just kind of updating and hopefully refreshing some of the information that you probably learned while you were there. And my goal is to just sort of go through this PowerPoint, but really to have a lot of time for you guys to ask questions if I do leave anything out. So feel free to ask me questions. Everyone can hear me just fine, right? No problems? Okay. All right, so again, my objectives are to sort of go over what lymphedema is, talk about how we treat lymphedema, what are the benefits through rehabilitation, and then to hopefully encourage you to participate in some exercise and give you some examples and some outlines for how you could start to do exercise. Okay, a little bit about lymphedema. It's sort of one of those things where I think not many people know a lot about lymphedema because there's not a lot out there, I think, in the sort of public world. Not a lot of doctors have a lot of time, I'll say, to explain what lymphedema is, what the risks are, and how we would treat it. So just a little bit about lymphedema. Following breast cancer, the risk of lymphedema is somewhere around 20%, give or take, depending on the surgery that may have been done, as well as the treatments that may have been done afterward, like chemotherapy or radiation. So the risk is about 20%. If there's axillary lymph node dissection, around 20%. If there's sentinel lymph node dissection, it's a little bit lower, between 3 to 10%. With head and neck cancers, it's even lower, 4%, and that is because gravity is somewhat on our side when it comes to head and neck surgeries. Our lymph system drains downward in the direction of gravity, whereas all other parts of the body, lymph has to drain against gravity. So that's why we see it a little bit less with head and neck. With genitourinary cancers or surgeries, 10% is the number. And does anyone know who that person is there? Kathy Bates. Kathy Bates has lymphedema, and so she has been, I think, the only or one of the few public figures that has sort of been outspoken about lymphedema. I think she was on one of the doctor shows. I don't know if it was Dr. Oz or the doctors talking about how she has lymphedema in her arms and how she wears compression garments. And so that was great to sort of see someone kind of speak about that and her experience with lymphedema. Okay, what is the lymphatic system? Again, I don't think many people are very familiar with the lymphatic system. It is part of the circulatory system. It's like your arteries, like your veins. We have vessels throughout the body that start small. They lead into larger ones and larger ones. Their purpose is to drain, to transport, to filter, and to remove lymphatic fluid. And what is lymphatic fluid? Lymphatic fluid is basically fluid that is a sort of waste product from cellular movement within our body. It's things that really need to be sort of cleansed through the body so that we can maintain our normal health. It's part of our immune system. That is its major function, is the immune system. And so we'll talk about what lymphedema is. Here's a nice picture of the lymphatic system. You can see all these little yellow squigglies. Those are lymphatic vessels. These round objects here are lymph nodes. Lymph nodes are the important component there because they are the filter site for lymphatic fluid. But you see that we have them all over the body, right? Just like, again, arteries and veins. This is a confusing picture, but I wanted to share it with you because I think it helps you understand. The red is representing blood that goes through the body that has oxygen, right? So it's ready to be pumped throughout the body to help with healing. Blue is where that blood becomes deoxygenated. There is no oxygen in there. And so the lymphatics are kind of this third system that take up any sort of lost components, and eventually they move them back up toward the area of the heart, where it is then joined with your venous system, which is the blue. So eventually it does kind of come back around, but you can see that it sort of has its own function in filtering the fluid. The lymph nodes are specialized organs that filter lymph fluid through a maze of connective tissue filled with white blood cells. So because they are filled with white blood cells, they are part of our immune system and they help us to fight infections. After it is cleaned, the lymph returns to the heart by the action of smooth muscle pumping and skeletal muscle. And that'll be important when we talk about the importance of exercise. It has one-way valves so that there hopefully is no backflow of this lymph fluid. And here's just a closer picture of what lymph nodes look like. We have them all over the body. We have a lot there in the neck. We have them in the trunk or in the chest area, and here in the groin. Some of these lymph nodes can be removed during surgery if there's been shown to be activity there when they do sort of imaging for those lymph nodes. Okay, so what is lymphedema? A buildup of lymph fluid which can cause swelling anywhere in the body, including the arm, hand, leg, or foot. During this lecture, we are going to be talking about secondary lymphedema. So that is lymphedema that occurs as a result of lymph nodes being removed. There is lymphedema that can occur from birth, and that is really a deficit in the way that the fluid is sort of brought up through the body right from birth. We're going to avoid that sort of a different category of lymphedema and only talk about lymphedema after surgery or treatments. Okay, why do I have a picture of a traffic jam up here? That's probably the question that you're asking. The reason is that we use a traffic jam analogy to explain what lymphedema is like. Basically, when we take away lymph nodes, when we take them out of the body, we have taken away some of the toll booths that fluid has to go through, right? So there's this backup of fluid that needs to move through the toll booths, and now I've taken away some, so there's less. And so as a result of that, there's a kind of this backup of fluid here. And these cars that are here, they really cannot move until we move the cars that are on the other end of the lymph node, if that makes sense. So as you're doing your drainage technique, what you're doing is trying to make room sort of above the area where the lymph nodes are so that more fluid can move through the lymph nodes. So that's my reason for including a picture of an awful sight, which is traffic in New York City, getting or around New York City. Okay, what are the risk factors for lymphedema? Lymph node removal, I mentioned, is one of them. Another one is radiation treatment, so radiation to the area. That affects the way the lymph nodes function. It can shrink the size of them. It can also cause scarring, so they're not filtering that fluid as well. Infection is the other risk there. Again, infection because the lymphatic system is part of the immune system, and an infection can cause some swelling to occur afterward. Another risk factor would be BMI is in reference to weight. So if your body weight is greater than a BMI of 30, which would be in an obese category, we can see there's a little bit more of an increased risk for swelling there. Specifically, if your BMI is greater than 30, then the risk can be 3 times as much. If there has been spread of cancer to a particular lymph node, that can, of course, block the flow of fluid. And then as we age, there can be a weakening of the lymphatic system. This is what we think could potentially be happening, but age is not always 100% a risk factor. I just want to share that the handout that you guys have doesn't have all the slides that I have up here. It really just has the most pertinent and important ones. So feel free to write anything down, but I believe that the ones that you have should be all the information that you are hoping to take away from this. What are the signs of lymphedema? Swelling in the area. A lot of people describe it as fullness or tightness, achiness, pulling of the skin. What we see is that there can be some skin changes. The skin maybe feels a little bit rubbery. It feels like a balloon. It feels stiff. And if that swelling persists over a certain period of time, it can become a little bit more firm and what we call fibrotic. As a result, people can explain that it feels like they have decreased flexibility. So if I have swelling in my forearm, it may be difficult for me to bend my elbow. It may be difficult for me to make a fist with my hand or to curl my wrist. If it's swelling in the legs, it may be difficult for me to bend my knee back. So in addition to seeing something different, let's say between the right and left, it may feel different as far as from flexibility. Again, we can see some skin tightness as a result of that swelling. There's limited movement. If it's head and neck related, there may be limitation with turning the head from side to side, with reaching overhead, getting out of bed. Lymphedema in general is not going to limit these things. It's something where the swelling is there, and so we want to be protective and sort of avoid that swelling getting worse. So we sort of stop doing certain things. We stop reaching overhead. We stop turning our head. And those things can cause secondary complications. So as a result of me having swelling in my head and neck, I may not turn as much. That can potentially cause tightness in my neck over a long period of time. If I don't use those muscles to turn my head, I may have muscle weakness that can result over a few weeks. Fatigue, if I'm not moving around simply because I don't want to make it worse, that can ultimately result in fatigue when I do try to move around. There can be pain associated with lymphedema if, again, it's really something that movement has been avoided. Heaviness in the arm or in the leg. If there is swelling that's in the upper arm, that may cause us to be more rounded. We can see some limitation in the shoulder. That can make us feel a little bit more rounded in the chest. So there can be some tightness in the front of the chest and some weakness in the upper back. That's where you'll see postural changes. Body mechanics, if I have swelling in my leg, it's possible I want to avoid using my leg, so I get out of bed in a different manner than I normally would. I get into and out of the car in a different manner. So that's where we can see these body mechanic changes. Changes in the way that I walk. If I have significant swelling in my leg, I may decide I don't want to bend my knee as much, so I sort of round it as I'm taking a step. That's going to change the way that I walk. When it comes to head and neck, I may chew differently because I have this swelling here. Maybe it's more on one side. That can affect the way that I chew my food. So now I only chew on the left side. So now these muscles are much stronger and these have become weaker. So there's kind of a whole cascade of things that can happen, not from lymphedema, but almost as a secondary to lymphedema. So again, there can be discomfort if there is significant swelling. There can be heaviness. Functional limitation would be I can't reach my arm overhead. I can't walk up the stairs. I can't put my clothes on. I can't put my sweater on. The site of lymphedema is something that people express as being part of one of the things that makes it difficult to manage, because it's kind of a reminder sometimes of treatment that they've been through. And over time, that can create some feelings of anxiety, some feelings of frustration, some feelings of sadness, because maybe there's hesitation with going out, with being amongst their peers, their family. So really a lot of things can result from lymphedema. And ultimately that can affect quality of life, which is basically happiness throughout your day and long-term throughout your life. So it's important that we treat lymphedema and that you guys are aware there are ways for us to treat it and to manage it. And this is a picture that I have from an x-ray. But I thought was interesting, so you can see lymphedema here and how large it is, let's say with this elbow joint here, compared to the size of the bone. Inactivity in general. We know a lot about physical activity and all the benefits of physical activity. Inactivity can lead to premature mortality. It can lead to increased falls. It can lead to bone fracture because those bones maybe are not getting enough input to stay strong, so they're losing some of their integrity. And as a result, there can be more disability, so the inability to do certain things if we have not been active for a period of time. On the other side, we know that physical activity can help all the things that you see listed here. It can help reduce cardiovascular disease. It can help with diabetes. It can help with sleep disorders. It can help with mood. It can help with osteoporosis, fatigue, and we're pretty sure that it can help with secondary lymphedema, which is why I'm sort of adding it to the list here. How can rehabilitation help? Rehabilitation can help with fatigue, with range of motion, which is your ability to reach up with your arm or move your leg. Range of motion is your ability to move throughout a joint's range of motion or flexibility. With muscle strength, flexibility I mentioned, with tissue texture. So if tissue has become firm, there's ways for us to kind of soften it up and make it easier for that fluid to move throughout the arm or throughout the leg. It can help with weight loss, of course, we all know that. It can help to improve your mood as you start to participate in exercise. It gets those hormones going that can make you feel better. That can help you with sleep. We know it can help with body image as well as overall quality of life. And I'm sure none of these things are new to you guys as far as how exercise and rehab can help. This is an interesting slide here, and when I first saw it a few years ago, it really stood out in my mind. It's basically showing you a cross-section of an arm that doesn't have lymphedema, which is on the left, and an arm that does have lymphedema on the right. And what you're seeing is all that yellow is fat tissue. Within that fat tissue, you see some dark tissue. That is muscle. Okay, so It's showing that on the right, there's a little bit more of fat distribution, which we would expect to see. There can be more fat distribution with lymphedema. But what's more important to see is that the muscles have really weakened a lot, right? You can really see a large darkened area of muscles here, and here we don't see quite as much of that muscle bulk. And that's important to point out because lymphedema doesn't cause weakness. However, if we are reluctant to use the arm or we're hesitant to use the arm, there can be weakness that comes as a result of that. And that's what we want to avoid. So just wanted to share that with you as far as muscle bulk. Okay, as far as treatment, what do we do for treatment? Well, the first thing is we would try to reverse the swelling, which we can do if it's a relatively early onset. There are stages of lymphedema, and the first two stages are what we call reversible. That means we can decrease the swelling that is there. We want to reduce the risk of infection. Again, I mentioned that earlier, that its major role is part of the immune system. We manage the swelling either with multi-layer bandaging or with the use of compression garments. We want to maintain or improve strength and flexibility and maintain function of the involved area. So we want you to continue to use your arm, continue to use your leg, to maintain your strength there and even build your strength in the affected area. If you should notice that you have swelling, of course you would let your doctor know, or you would talk to the nurse, and they might say to you, you know what, it's a good idea for you to go to Rusk for physical therapy. So they might write a script for physical therapy for lymphedema management of the head and neck, of the right arm, of the left leg, whatever it is. Just a little reminder, October is Physical Therapy Month. So thank you all for participating in this celebration of Physical Therapy Month. This is an interesting picture. I sort of joke about this picture. How many therapists does it take to stretch a hamstring? There's 4 of them there. Okay, so as someone arrives to physical therapy, they might say things like, my arm feels heavy, it feels tight, or it feels full. I have trouble lifting my arm overhead. I have trouble turning my head as I cross the street. I can't bend my knee or put my shoes on. I can't open a jar with my right arm, or I have trouble carrying groceries. These are things that people might say or you might experience if you have swelling in either an arm or a leg. And what is the first thing I do? I talk about lymphedema precautions, things we can do to try and prevent that swelling from getting any worse and try to reduce the risk of infection. So you see on there meticulous skincare. That is very important. Things like keeping your skin clean, keeping it dry. If you should have an opening of the skin, it should be cleaned and covered. It should also have moisturizer on it to keep the skin from cracking. Avoid blood pressure or blood draws in the affected area. Avoid extreme temperature. So if you're going to be in warm weather, that you either go inside, take breaks if you can, wear a long sleeve shirt if it's the arm that's affected, so that the arm avoids getting any sunburn on it. Avoid bug bites. Bug bites are openings of the skin. That's a place where an infection could enter and potentially spread. The concern is that the infection, if one should enter, will spread a little bit quicker in the affected area than it would on somewhere that does not have lymph nodes removed. So if it is the right arm that is affected, we are not concerned about any openings of the skin, let's say in the left arm, in the left leg, right leg, anything like that. Avoid repetitive or heavy lifting. So you want to avoid heavy lifting if it's the arm that is affected. But heavy lifting is really a relative term. Heavy can be different for everyone. Some doctors will say, do not lift anything over 5 pounds, do not lift anything over 10 pounds. But what's more important would be, how heavy is 5 pounds for you? If you are used to lifting 5 pounds, it's probably not a problem for you to have to lift your groceries. If you are not used to lifting 5 pounds, you may want to avoid lifting that amount of weight if you're not used to doing that. Use moisturizer, as I mentioned. The signs of an infection. Does everyone here know what the signs of an infection are? You should know. It's in your handout. It's also up here on the screen. So there's some increased swelling in that area. There's redness, there's a rash or a blister. It looks different. Instead of a bug bite that looks like it's getting smaller, it's getting larger and it's spreading. If that were to happen, you would call your doctor right away and you'd want to get treated for that infection. Unfortunately, once you have an infection, there's an increased risk for getting further infections after that. So you would want to avoid if you could. During an evaluation, what are some of the things that we kind of go over? If it's someone coming for head and neck, I look at things like, can they touch their chin to their chest? Can they turn all the way from their right to their left side? That's important for when you need to cross the street or when you're driving. Can you side bend from side to side? And can you look up on a diagonal? We don't really kind of think about all the things that we need to do with our head as we're walking, as we're crossing the street, as we're driving. We need all of that for our safety. So it's important that we have normal range of motion there. With jaw movements, sometimes people have changes in the way that they eat or the way that they swallow as a result of surgeries or swelling here. For the arm, again, we look at, can you raise the arm overhead? Can you bring it all the way out to the side so that if you need to reach into a cabinet, you're able to get all the way up to the top? If you need to pull over the shower curtain, are you able to do that without any restriction? Sometimes I have to say these things individually because we don't even think about it. You know, I always just use my other arm, so I don't really think about that I can't really use my right arm because I just always use my left. And that's okay, but sometimes if we kind of go through them step by step, it kind of jogs the memory of, oh, you know what, I do always use the other arm for those things. For the legs, you know, I have trouble lifting my leg up when I'm trying to, let's say, go up the stairs, or I have trouble turning my leg in or out, which I need when I have to get into and out of the car. I have trouble bending my knee back, which is required for when you put on shoes or sneakers, pointing and flexing your toe, and going upstairs I mentioned. This is a sheet that, again, I give out just to give specific examples. If the arm is involved, things like, do you have trouble brushing or combing your hair, washing your face, putting your socks on, tying your shoes? Kind of go through these things and do a mental check. Do I have any difficulty with these? No, I'm okay. Or, you know what, I do always use my left hand whenever I have to open a jar. So this is just something that we go over. This happens to be for a prosthesis, but it's very similar, the one that we use, so I just thought I would share it with you. And the one for the leg is very similar, but things like getting into and out of the bath, or walking between rooms, putting your shoes or socks on, squatting down, walking 1 mile, walking 2 blocks, standing for an hour, sitting for a half hour. So these are things that specifically we ask about. Do you have any difficulty with them, or are they affected by the swelling that you have in any way? You know what? It's true. Whenever I go to the movies, I can't really sit there for 2 hours because my leg starts to feel heavy or it starts to get more swollen. So I do find that I have to get up or I have to kick my leg back and forth. What do we do for treatment? We do what we call complete decongestive therapy. It's manual lymphatic drainage with multi-layer bandaging or some kind of compression garment, as well as exercise. And you can see some examples of bandaging here. That picture that's on the other side is showing you the direction of how we do drainage and where we go to. There's a sequence in the drainage. It's not just a massage technique. Most people think that it is. It is a gentle technique that is used to encourage fluid back up toward the center of the body, really. We use circles, we use pumps, we use circle pump, we use kind of different forms of manual technique to help that fluid to move. Basically, our goal is to very gently move the skin, and that helps the lymphatic system to start moving and start uptaking fluid so that it can be moved through the lymph nodes. External pressure on the cell wall by muscle contraction or by drainage, which I just mentioned, is what causes fluid movement, which is why lymphatic drainage is so important. I just thought I would show you what the lymph vessels look like. If you look over here, they do have one-way valves so that it prevents fluid from wanting to kind of have this backup of fluid this way. They're only allowed to propel forward. On that picture there, you can see that muscle pump kind of squeezes those vessels, and that's how it gives it energy to sort of move upward. Here you can see a little picture of our skin layer. So this is kind of the outermost layer, and all the way down here is muscle layer. But really in here, where we have kind of fat tissue and vessels, that's where the lymphatics are, the superficial lymphatics. So this is the area that we want to target. So when we do a drainage, we are not trying to get down into where muscles are, like a deep tissue massage. It's actually a very gentle massage that we are doing because we only want to get down to this kind of layer in there. Does that make sense to everyone? Breathing. Breathing is probably the most important exercise that we can do for the lymphatic system. Our lymphatic system does not have a pump like our heart, right? So breathing kind of functions as the pump of the lymphatic system. Our diaphragm is a dome-shaped organ or muscle, And as we inhale and exhale, it moves up and down. That stimulates the thoracic duct, which is our largest lymphatic vessel, and that kind of makes all the lymphatic system vessels sort of begin to absorb fluid and then release. So it's a lymphatic system pump. As we inhale and exhale, it creates changes in intra-abdominal pressure. That pressure creates a suction effect on the lymphatic vessels, and it propels the fluid upward. Okay. So if you take nothing away from this lecture, I hope that you practice deep breathing, and there'll be further pictures, I think the next slide, on how exactly to do that. When you do deep breathing, we are not doing chest breathing, right? We are inhaling so that our belly fills with air. So as you inhale deeply through your nose, everyone do it now with me. Your belly fills with air. Exhale through your mouth, your stomach should come in. So you inhale, your belly fills with air. Exhale. So we smell the flowers. You blow out the birthday candle. Okay, that's how we perform deep breathing. This can be done throughout the day, multiple times every hour, 3 to 5 times usually. I don't recommend going anything more than that. That can usually lead to lightheadedness, so I only want to do a couple at a time, but that's the best thing that you can do for a lymphatic system. Okay, after surgery, there can be a lot of incisions. There can be areas of skin tightness or soreness. As a result of that, there can be muscle tightness or changes in flexibility, which we talked about before. There can be limited mobility or range of motion. There can be muscle weakness, nerve tension. So the nerves can also have tension on them, which can cause pain, tingling, numbness. Those can be addressed during rehabilitation, as well as pain from all of those above stated things there. Postural changes. Again, the way that you sit might be different. You always lean away from the arm that has swelling, possibly, or you always lean away from the leg that has swelling, or the head for that matter. Maybe the way you stand is different. So if I'm supposed to stand with equal weight on both legs, I always lean away from the leg that has swelling. So I'm mostly weight bearing through my left leg, let's say. As a result of that, my left leg muscles may be a little bit stronger now, and my right leg muscles may be a little bit weaker now. I never like to sleep on my left arm because it's uncomfortable, or I don't want the swelling to get worse. So now I'm only sleeping on my right arm, and I'm tired of sleeping on my right arm because I need more variety. So that's something that we try to address in therapy as well, kind of working through what are different positions that are available for sleeping. Body mechanics, going over, getting out of bed, dressing, grooming, opening cans or jars, filling the water container. That's a big one that people mention because as you fill the water container, it gets heavy, right? And it's top heavy, so sometimes it can be difficult to take it out of the fridge or bring it back into the fridge as it's heavy. So that's always a big one that people talk about. Lifting groceries or lifting their shoes from the ground, carrying bags or carrying children. Those are important things that you want to be able to do in your daily activity. So if they are a problem, we try to address them. Specifically, what do we do in rehab? With incisions or scars, we do a scar massage. You know, as we are healing, what happens is those incisions want to close, which is a good thing. So the body sends a whole bunch of collagen fibers there to kind of patch up the hole, which is great. But what can happen is those collagen fibers can really be jumbled as they kind of form. And so a gentle scar massage can help to smooth it over so the incision is a little bit more flexible and it doesn't create secondary changes where now my entire shoulder is tight or now my upper back is tight as a result of that one tight incision there. Muscle tightness, of course, we can do stretches for that. Muscle weakness, we do strengthening. That is our specialty, right? With nerve tension, there are ways that we can stretch the nerve, believe it or not. That can reduce the amount of numbness or tingling if it's coming from nerve tension. And of course with pain, there's many ways we can try to address pain, both with modalities, things like heat or ice. We tend to avoid heat in the affected area, right? We would probably want to stay more toward ice if we can, as well as other things that you see up there, stretching, postural changes, nerve glides. Electrical stimulation is really something that is used for pain, but in the affected area we may try to avoid. Elevation. Have people done elevation for, let's say, their arm or their leg, or I've heard that's a way that you can treat it? Elevation can be used. It is not a way to cure lymphedema because it is not totally water fluid that is in the arm or the leg. So elevation in general is not going to cure it. However, it can help to reduce some of the swelling that is there. So Elevating your legs for 10 or 15 minutes every night is a great way to try and reduce some of that water fluid in there. Elevating the arm, again, 10 or 15 minutes, maybe before you put the compression garment on, is a way to manage it. With the head and neck, it's basically in a gravity-dependent position anyway, or gravity-assisted position, but you can sleep with the head and neck elevated. Compression garments. There are a variety of compression garments available for the head and neck. For the upper arm, which you see there, the arm and the gauntlet, which is the handpiece, and for the leg. If you're going to wear a compression garment, they are meant to basically keep the arm or the leg the same size that it is. That is its job. It keeps everything the way that it is. It has been shown to be able to treat lymphedema in the very early stages. So if it's very early on, there's only a little bit of swelling. We know from some studies that the sleeve is enough to treat lymphedema if it's very early on. And the same thing for the leg. You want to be measured for these garments by a certified fitter. That is someone who's been trained in how to measure properly, because if they are not measured properly, they could potentially lead to more swelling. You also want to get a new compression garment approximately every 6 months or so, because they do stretch. You do change in body composition, so you'd always want to be measured and get a new compression garment. The big thing with using compression garments is you never want to sleep with them at night, and they should always be washed, of course, especially if you're wearing them every day. And you don't want to use woolite because that changes their stretching capabilities. Are you guys familiar with compression garments? Does everyone have a compression garment? Yes.
I use like delicate woolite.
Yep.
What's wrong?
I don't know if delicate woolite is okay.
Well, what would you recommend?
They usually just recommend regular detergent.
What is that? Like Dawn or like Era?
Yep, you can just use regular Dawn, and then you would rinse it and you lay it flat to dry. Anyone have any other questions about compression garments? They are generally not covered by insurances. Some insurance companies do pay for them. I know that Medicare does not pay for insurance, not pay for compression garments. And depending on if they are standard size or they have to be custom, of course, that's going to change the cost of them. Do you have a question?
Yeah, I want to know if it's right to wear a glove first and then sleeve.
To put your glove on first?
Yes, first gloves and sleeve. It's okay, yes?
I don't think it matters. I think for convenience, some people like to take the glove off if they have to do something quickly to wash hands and then put their glove back on. But I don't think I think it's okay.
For how long we can take glove off?
For how long can you take it off? It's different for everyone, right? So some people can take off their compression sleeve for an hour a day and they don't have any increase in their swelling, and that's fine. And some people can take it off for 10 minutes and there's swelling that can result after that. So it really depends on how your arm is doing. If you can leave it off for 2 hours and nothing happens, then I would say you can leave it off for a little bit each day. You do want to leave your arm or your leg exposed to air for at least 1 hour per day. Whether you're wearing bandages for a short period of time to treat the swelling or a compression garment, you do want to have it off for at least 1 hour per day so the skin can breathe. Does that answer your question? There are nighttime garments, so generally a compression garment is for the daytime and you would wear bandages for the nighttime, because you do not wear compression garments to sleep in. However, there are alternative nighttime garments, which you see here. One that kind of looks like an oven mitt sort of thing for the arm, for the leg as well. And these down here are a little bit newer garments. They're more sleek. They're a little bit thinner. They're Velcro, basically. The one that you see in the middle is a custom garment. So is this one on the right here. Although now, of course, these companies are coming out with more standard sizes that can be cut to sort of be adjusted if the arm or leg should get smaller. But these are alternatives for the nighttime.
How often we have to change them?
Another good question. It depends. Some people, because these are so sleek, they use them for the daytime too. And if that means you're wearing them daytime and nighttime, you know, it would depend on the size. Are they the appropriate size? Are they becoming worn?
No, I mean if I use it only at night.
Yeah, use it only at night.
But how often we have to change them? 6 months too?
I don't know if it has to be 6 months because you're only wearing it to sleep. It's really not being exposed to anything that would make it dirty.
But I mean for the size.
Yeah, it would depend. If you were getting smaller, then you would of course want to get something in 6 months or a year. But if you were sort of just maintaining, if you were just wearing a sleeve during the day and just wearing these at nighttime, you're probably maintaining at that point. And so you may not have to get one every 6 months, maybe once a year. It's possible. It really would depend on your shape and size and if this was still meeting the proper compression. There's no right answer really for that.
How do you know?
How do you know?
Compression.
Some of these have little black markers on them. This particular one is called a Juxtafit. I don't know if any of you are familiar with it. It's called a Juxtafit. You have it? They are made with little black hash marks on them, and when you order it, it has a little sizing card with it so that you can determine how far apart those two little black hash marks are, and that's an approximate amount of how much compression it's giving you. So if you stay within that certain hash mark, it's hopefully giving you uniform compression throughout the arm or throughout the leg. That's how you would know. If those two hash marks were so far apart, it's probable that that garment is really stretching a lot and maybe you have more swelling than what it is capable of keeping in. There's no right answer. The best thing I would say to do is, if you were measured by a fitter, you could bring it to them and say, I've had this garment for 2 years. I just want to make sure that it fits me properly. Either the fitter who measured you or, of course, a therapist who could potentially make that assessment also.
Who determines if you should have this type of a garment? Instead
Who-
of doing the compression, the bandaging at night.
The bandaging. Okay, well, bandaging is used to treat the arm, right? So we would use it,
I'm sorry, I mean, who determines that you should have this garment? What's
this particular garment.
Yes, instead of.
You know, there are a variety of garments out there. There's this one, there's a black one, and who determines which is the best one? You would determine which one you would like the best. There's nothing right now that says this is the best garment. This is the absolute best garment, and you can't use that garment because that one's not as good. We don't really know which one is better than the other. It's a matter of comfort. Which one do you like? Which one is potentially within something that you can afford? That would be another significant factor. You know, there's no 100% right answer which is the best garment. We know that there's some good success with these garments because they are very easy to put on. You slide it on, you do the Velcro, it takes about 5 minutes, probably less, and you're ready to go to sleep, or you're ready to start the day. It's much quicker than using bandaging.
It's a name, so it's a specific garment.
This one is called a Juxtafit, sort of a weird name, Juxta, Fit, F-I-T. It's by Circade, the company Circade, they've been making garments for a long time. And they have one for the leg as well. Yes, yes.
What would determine whether somebody would get a standard compression garment or
Or a custom one.
Right.
That's a good question. And the fitter is the one who really makes that determination. They have a size chart for what they know. This fits into a size small. This fits into a size medium. This fits into a size large. And this fits into a regular length as opposed to a long length. And anything outside of that, they make the call. It has to be a custom garment. That's how it is. Yes?
And the fitter would be like the PT or?
The fitter is usually a certified fitter, and in general, it's someone who is at a surgical supply store where they could be measured for garments. A therapist can measure for a garment, and in other clinics, sometimes they do. In our clinic, we don't measure. We take our own measurements, but we do not measure for compression garments.
Would you need like a referral type?
Yes, you do need a prescription for compression garments, and the reason is because it is giving you a little bit more compression than what you could buy, let's say at CVS, that's just for the leg. It's giving you more than 18 millimeters of mercury. It's somewhere for the arm, it's between 20 and 30. For the leg, it's between 30 and 40. Anything above 20 requires a doctor's prescription. Does that answer your question? Yes.
I'm sorry to disagree, but I was told I don't need a prescription if I'm going to pay for it myself.
Yeah, so yes, you can get one from a surgical supply store and you can pay for it. If your insurance company is not going to provide any reimbursement, then they have said yes, you don't need to get a doctor's prescription. But if you do want to have the company reimbursed, then you would need a doctor's prescription for that. Okay, Kinesiotape is something that we use in the sports athletic world for different injuries, and we can use it for lymphedema as well. Has anyone seen Kinesiotape before or know what it is? Sometimes you see professional athletes on TV and they have this kind of funky tape color on them. Maybe it's pink or it's blue. Sometimes they wear it on their shoulder, or they wear it on their leg. We can use it for lymphedema as well, and it has actually pretty simple benefits. What happens is it sort of pulls the skin away from that top layer, and in doing so, it kind of creates a little bit more room so fluid can kind of move through that area a little bit better. And I've seen actually some pretty good results from just using Kinesiotape. It's a special kind of tape. You wouldn't just take your Scotch tape and put it on your arm. It's a little bit more durable. It stays on for a couple of days. And we use this kind of spider configuration in a particular direction to mimic where we want the fluid to go. After treatment, of course, there's other things involved like chemotherapy or radiation that can also create things like limitations in range of motion, pain, discomfort, and with chemotherapy specifically, fatigue is a big one there, as well as osteoporosis or osteopenia. So I'm just pointing this out because, again, this is something that in rehabilitation we try to address those issues along with any swelling that could be present. Air travel. There may be some questions about air travel because there's some information regarding lymphedema and its changes during air travel. Basically, the NLN, which is the National Lymphedema Network, has a statement saying that if you do have lymphedema, we recommend that you wear some kind of compression garment while you are flying. The specific instructions are leave the garment on for 1 to 3 hours after deplaning to allow tissue pressures to equilibrate. For individuals at risk, so you don't have lymphedema, but you have had lymph nodes removed, or you have had radiation to the area, it's really a judgment call. We at NYU do recommend wearing a compression garment as long as your doctor is okay with that as a prophylactic to prevent the possible increase in swelling while you're in flight. However, if you choose not to, if your doctor says it's really not a big risk, I'm not concerned, then you don't have to wear it. So it's kind of, you can do either one, and this is really where we are with research as far as the risk of getting swelling during flight. Okay, a little bit about research. I don't want it to get too boring here, but I do just want to share with you a little bit about research in regards to exercise and the treatment of lymphedema. So what we know is that there's lower incidence of lymphedema in women who exercise regularly. If they were educated about the risks of lymphedema, so those precautions that I shared with you earlier, things like no blood pressure in that area, avoid extreme temperatures, make sure that you reduce your risk of infection by cleaning the area, as well as if you perform self-care activities or you're being physically active, including use of the arm or of the leg. Okay, this study was done in Korea in 2010. Basically, 40 people, they all had lymphedema. 20 of them did extra exercise. All of them, I should say, had a warm-up. They did movement of the shoulder, so they did things like shoulder rolls, they did pulling, but no weights or any kind of resistance exercises. Both groups had manual lymphatic drainage. They both had bandaging done. One group did more exercise. They did seated rows, which is this one. They did a bench press, which is this one. They did a lat pull down, which is this. They did one arm bending over row, which is where you pull back this way. Tricep extension, which is where you push your wrist away from you, I'll say, and then a bicep curl. That's all they did. And what they found was that both groups had improved physical functioning and reduced body pain, as well as improved mental health, because they were taking care of the lymphedema by treating it. But the active group had improved physical health, and they had reduced volume reduction from doing those simple exercises. It's important to know that these exercises they did for an 8-week period. They did them every day, but they used very light weights. They used like 1 pound or 2 pounds, okay? This one was an even larger study, 141 participants. Basically, they had an active group and an inactive group. What they found was that there was no change in the swelling for these people. But those that did exercise, of course, they had increased muscular strength. They had reduced exacerbations of the swelling. And they did have decreased severity of their symptoms in the arm or in the hand. So how should you get started? Of course, you want to talk to your doctor. Make sure it's okay for you to start an exercise program if you're not doing one. You want to maintain your precautions. You want to wear a compression garment when you exercise. And you always want to begin very slowly. You want to do a small amount of repetitions, somewhere between 5 and 8 if you're not used to doing exercise. And you want to start with very light weights. The most important thing is that as you are doing exercise, you start very conservatively, and then you slowly progress with the number of repetitions and the number of weight, the amount of weight. I love these pictures. They show in that particular movement what muscle is being stretched. So you can see she's turning to the side, or I'm sorry, she's side bending. This one, she's turning this way, so you can practice turning your head from side to side. This one, she's leaning over to stretch the upper back. Some other exercises you see here for posture. So the deep breathing we already did, the side bending, looking up on a diagonal, that stretches the front of the neck. Doing some shoulder rolls backward, that's really important for posture and getting the tissues within the shoulder nice and loose. He's doing a rowing exercise there. He's also doing a pull down with the TheraBand. More for the upper body. I like arm circles too. That helps to warm up the shoulder. You see her lying on the side doing some arm circles. This is a great one. We're now incorporating some elevation here while doing some arm circles. She's doing some wall push-ups over there, so she's using her triceps to extend while she's pushing away from the wall. Some wrist circles, those are easy to do. Walking the ball upward. She's doing planks here. This is what we call a bird dog. Some people ask about that. Is it okay for me to do planks? Is it okay for me to do a bird dog where I'm putting weight through my arms? And we don't really know. You know, some people can do planks and not have any difficulty, and some people, they can have some swelling after they do a plank for even 10 or 15 seconds. So you'd want to wear your compression garment, and again, you'd want to start off very slowly. Some more stretches for underneath the arm, for the front of the chest. That's always a big one that we try to address, because if there are surgeries in the front, they can cause more tightness within the front of the chest. Some more stretches for the back of the leg there. This is from handsfromheaven.com, which is why I just indicated that. I think they have great pictures. Okay, how do I get started? Aerobic exercise, things like walking with an asterisk, because that has most research behind it following breast cancer treatments. Things like swimming, biking, dance class. The goal is, of course, 30 to 60 minutes most days of the week. You want to start off very slow. And there's a target heart rate up there. Around 60 to 80% of your maximum heart rate. Your max heart rate is really the highest heart rate that you can sort of get to. You want to be less than that. So you want to be able to have a conversation while you're exercising. You don't want to be short of breath. The way you would find your target heart rate is it's 220 minus your age is the approximate amount of max heart rate. Yes?
If you are swimming, do you wear your compression
Okay,
garment?
good question. I would not recommend wearing your compression garment when you swim. Swimming is a great exercise to do because of the hydrostatic pressure that can be on the arm or the leg.
But you can do crawl and no limitations in the water.
I don't think so. You know, how many crawls is too many that could create more swelling? I don't know.
Breaststroke is better than, it's all the same.
From what I know, it is all the same. But, of course, I would say be conservative so that you do a few, let's say, laps, 2 or 3 laps. That night, you see how the arm is, it's okay. The next day, you do 2 or 3 more laps and just kind of slowly progress. That would be the best thing I could recommend. Okay, with strengthening, you want to use large muscle groups. So you want to start with your shoulders, then you can go down to your elbow, then your wrists and your fingers. With your legs, you want to start with strengthening your hips, then your knees and your ankles. Your goal is somewhere between 8 to 12 repetitions, 2 to 3 sets of each one. The benefits of resistance training are up there, especially with cancer-related fatigue, bone density, body image, self-esteem, mood, and we added lymphedema in there. Okay, some examples of how you can use resistance bands. So you see these ladies are showing us different ways that you can use resistance for the back, for the chest, for the biceps. This is my mom here that I thought I would add because she found resistance bands over the weekend and she asked me how she could use them. So we had like a little session and I thought I would include it in here. If you like to use an exercise ball, you can use balls in different ways for exercise, both for the arm and reaching overhead. Squatting down, this person is kind of squatting down with the ball and then reaching it up as she stands. That person in the middle is kind of crunching up with the ball.
Where you can get these exercises on the same side?
Where can you get them? These I just kind of did a search and tried to find some examples online. There's no kind of set program for what exercises should you be doing. It's really just about getting the muscles to pump and getting them to work. Yes, you want to be safe about it. You don't want to have any pain or any discomfort, but really any exercise that kind of gets you moving is probably a good one for you to do. These are a little bit more targeted for the legs: straight leg raises, bridging, marching, so lifting one knee up, lunging, which is what you see in the middle. She's doing a little bit of a squat and jump. That's a little advanced. Just doing a squat would be a good place to start. Doing some heel raises behind a chair, and then some ankle circles. Okay, just again to reinforce what we've been talking about, exercise increases lymph flow into the lymphatics. Resistance training can help protect the arm from accidental injury by reducing the relative stress of daily activities. With weight loss, we can see up to a 5% weight loss, which is really a small amount, can help actually to improve the flow of lymphatic fluid. So, people know that you are at this lecture, and so when they ask you, so what did you learn tonight about how you can manage your lymphedema? I hope that you guys remember that the important things are meticulous skin care, to do diaphragmatic breathing throughout the day, to wear your compression garments as a prophylactic when you exercise and during air travel if you should have swelling, and then to do exercise but be conservative in the way that you progress. So you want to do small amount of repetitions, small weight, and slowly progress. These are some resources for you. I think they are in your handout. Okay, National Lymphedema Network. This is something where you can become a member, and once you become a member, you have access to articles that they publish. They have some exercises on there. So it can be a good resource for you if you're looking for more information and maybe you've already been through treatment and you're looking for more direction. These are two books that we have in the clinic that some people find to be helpful, just about lymphedema. Some exercises are in there. Again, the lymphedema precautions that we discussed. Okay, I went through everything, and we don't have much time, but I do want to answer any questions that maybe I have left out during our lecture. Yes?
Yeah, you touched on self-massage. Could you
Yes.
talk about that a little bit more, perhaps demonstrate?
Yep.
You know.
So when you do a self-drainage, if you've been taught by a therapist before, your goal is to move fluid out of the area by first opening up the pathways a little bit more, what we call proximally, or closer to the heart. So if we were doing drainage for the arm, let's say, we would start with doing deep breathing. That's always the first thing that we start with. Then we would start with a gentle massage over the lymph nodes in the neck. So we would do a gentle stretching of the skin in a downward direction from the middle of the neck to the base of the collarbone. Then you would start at the top of the arm, and you're gently stroking your skin in an upward direction all the way around, and you're slowly working your way down the arm. So now I'm going from the elbow to my shoulder, from my wrist to my shoulder, from my hand to my shoulder. And the leg is done the same way. I would want to start with the inguinal lymph nodes, which are here in my groin. I would start with the top of my thigh. I'm gently moving my skin in an upward direction, very slowly. I would then work to my knee, from my knee to my thigh, from my calf to my thigh, from my foot to my thigh. So this is the basic pattern of how to do a drainage. You know, is there a specific one that is more helpful? No, it's just a very gentle movement of the skin.
Is there anyone on YouTube that we could see?
There are some on YouTube, yes, and I tried to actually include a link so that you could see how gentle it was. There are different methods of doing drainage, so you will see different things out there as you're looking at some videos. Some people, again, they use a scoop. Some people use more of a cupping. Some people use more circles, so it's different what you'll see. But you could find them online, yes. Are they reputable? That's tough to say. I don't really know which ones are on there, but I do know there are a few. Yes?
You don't wear the garment when you're doing the drainage.
Right, thank you. You want to be directly on your skin, okay? You do not want to do this over your compression garment. It should be directly on your skin.
Other exercises you should be wearing. the
Yes,
garment?
during other exercises, you should be wearing your compression garment. Yes.
What are the names of those books again?
Oh, I'll put them up. Yes, another question. Yes, question? Yeah.
So where do you pick those up?
Where do you pick them up? I suppose you could probably find them online.
Online, okay.
So they are both entitled Lymphedema, Understanding and Managing Lymphedema After Cancer Treatment. There are, of course, more books on lymphedema. These are just two that I know that we have in the clinic that people have found to be useful. They're relatively easy to read, yes.
We gotta pay for it?
Do you have to pay for them? I believe so, yes. I don't think they are free.
You know what you can also check out? I know that the National Cancer
Institute, they have a website and it's a publication section. And they usually either mail them to you for free or let you download and print them. And they usually do not charge for any of their materials. So if you just Google National Cancer Institute, just type in lymphedema and they might have some stuff too.
How could you get into a physical therapy program?
Okay, to get into physical therapy would be a prescription from a doctor. It could be any doctor. It could be cancer-related doctor or a general physician for lymphedema management.
You have programs here.
Yes, so at 38th Street, that's where I work. We have a program for lymphedema, yes.
And how often is it? You have it during the day? At night?
It is during the day. We do have evening hours too. And in general, the treatment is 2 times a week, 1 or 2 times a week, depending on what the treatment is. And during that treatment, there is manual lymphatic drainage done by the therapist, as well as bandaging, and then some exercises.
How long do you want to go for physiotherapy?
How long do you have to go? It really depends. Usually if we're doing an intense treatment where we're trying to get the arm or leg smaller, right, we're using bandaging. The bandages get the arm or leg smaller. And that's done for a couple of weeks, somewhere between 4 weeks, 3 weeks, 5 weeks. We do measurements to see as that arm or leg is getting smaller. And once it kind of plateaus and we decide, okay, now it's time to get a compression garment, then it's time to get a compression garment, and then you just maintain at that point.
So the steps are, you start to massage, get it out as much as you can, then you put the
Compression garment on,
and you
yes.
keep that forever?
That is a maintenance, yes. At this point, we don't have an end time for, you only have to wear your compression garment for 1 year after lymphedema, and then you don't have to wear it anymore. We don't really know. So we say to be conservative and wear it for daytime hours, and then at nighttime, you wear something else for compression, or some people decide not to do anything at nighttime. They only wear their compression sleeve for the day.
2 years past my operation.
Yeah.
Is that too late?
Nope. So is it too late to do what?
Do the massage?
Absolutely not. So these precautions and the risk for lymphedema is what we consider to be lifetime. So once lymph nodes have been removed, or
Yes, yeah.
once there is radiation, these precautions are lifetime. So it's not as though after a year or 2 years there's no more risk of lymphedema. It could happen at any time after that surgery has been done.
I have 4 years today and it started 2 months ago.
4 years.
No, yes, I have 4 years after surgery.
Yeah, and that's
but
when it
2
started.
months ago.
The precautions are a lifetime. It can happen at any time, and we don't know why that is. We know that it's from the lymph nodes being removed or radiation to the area, but we don't know why some people can have, let's say, immediately after surgery, or 2 years after, or 3 years after, or 10 years after.
How about 30 years?
Could be 30 years after. They are lifetime precautions. You know, in the lymphedema world, we don't know why some people are developing lymphedema and some people do not. Some people can have the same amount of lymph nodes removed. I've had 5 removed here and I never have any swelling, or I have 5 removed and immediately after I have swelling in my arm. We're not really sure why some people are having it and some are not. There's some studies being done about genetic factors that could potentially play a role, but we don't really know right now.
We'll take one final question for today.
Yes.
Someone has mild lymphedema, does that
Yes.
mean they wear the compression garment as needed as opposed to all the time?
Depending on how much swelling there is, yes, we would try to be a little bit more conservative and say it's very mild. Let's have you do drainage maybe a few times a day, 2 or 3 times a day, wear a compression garment, and see if that is enough to reduce it, yes.
Okay, let's thank Amanda. That was a great speaker.
Thank you so much.